How many times in your life have you had the chance to change the lives of millions of people? People that are forced to prick themselves every day several times just to stay alive. Diabetes is a daily struggle for 382 million people. 40 million of them have lost the ability to produce the insulin hormone and are dependent on insulin injections on a daily basis. 2 million of them suffer from severe unstable diabetes and are not able to balance their blood sugar levels. By the end of this movie, more than 1 million people will administer insulin to themselves. As of today, the cutting-edge treatment for diabetes is transplantation of insulin-producing cells by infusing them to the liver. Unfortunately, 80% of the cells do not survive the transplantation, rendering the treatment ineffective for the long term. Is this how the story ends? Not if you ask us. Meet Betalin Therapuetics, the next generation of insulin-producing cells transplantation, providing a solution for insulin-dependent diabetic people. So, how does our technology actually work? We use tissue engineering. We take natural tissue and remove the cells in the lab, creating a biological element, a scaffold, which has minute dimensions. We found that this scaffold can serve as the optimal environment for the insulin-producing cells, enabling them to function properly. Then, we seed the insulin-producing cells onto the microscaffold. We have just created a natural, smart, and highly effective micropancreas. What's next? Now, the surgeon can implant a few hundred of the micropancreas in the patient's body via a minimally invasive procedure. And that's it. The implanted cells are now capable of independently producing insulin in response to the patient's sugar levels. With our innovative micropancreas, Betalin Therapeutics strives to provide patients with a one-time procedure which is highly effective, cost-effective, and with long-term effect. So far, we have performed thousands of lab experiments with clear and strong results. Further promising animal studies give us the confidence to continue with our efforts and find a cure for diabetes. As we speak, we are moving forward with additional studies and preparation for FDA and our next step, a human treatment using our micropancreas under clinical studies. To ensure best results and support our vision, we gathered some of the best minds in the field. Professor Ed Matrani, Chief Scientist and Head of Scientific Advisory Board, the developer of the technology, a world-renowned scientist in tissue engineering and regenerative medicine, co-developed the technologies of medgenics and ontogeny. Professor James Shapiro, member of the Scientific Advisory Board, a world-leading expert in cell transplantation, the developer of the Edmonton Protocol, the state-of-the-art of insulin-producing cells transplantation. Professor Camillo Ricordi, member of the Scientific Advisory Board, a world-leading expert in cell transplantation and developer of Ricordi's chamber for insulin-producing cells isolation. Let's make a change together. Join us in our efforts to find a cure for diabetes. Betalin Therapeutics, a game changer in diabetes.
We are using the same human pancreatic islets as the Edmonton Protocol. However, instead of transplanting those pancreatic islets directly to the patient, knowing that 80% of the islets will not survive the process, we are suggesting to use our biological scaffold and seed the human pancreatic islets on the scaffold, creating the endocrine micropancreas. Once the endocrine micropancreas is ready, a quality control test are taking place prior transplant it transcutaneously under the skin. After the transplantation procedure, a vascularization process starts and blood vessels are created, allowing a good blood supply to the micropancreas. This is how our endocrine micropancreas looks like. Its dimensions are 7 mm diameter and 300 micrometer width. Using our endocrine micropancreas dramatically increases the survival rate of the islets. Almost 100% of the islets survive the procedure versus 20% when using the Edmonton Protocol. Today, when using the Edmonton Protocol, between 2 to 4 donors are needed in order to treat a single patient. With our endocrine micropancreas, one donor will help 2 to 3 patients. With our technology, the endocrine micropancreas is transplanted under the skin using a local anesthesia and with minimal risk to the patient, while the Edmonton protocol requires transplantation into the portal vein of the liver. This requires general anesthesia and has some risk to the patient. Because of those reasons, we found the endocrine micropancreas to be highly effective, reduces the cost by more than a half, and maintain a long-term effect. As part of our strategy, we have 3 endocrine micropancreas products in our pipeline. The first product, we are using human pancreatic islets to allow us the fastest time to market. In the second product, we will use human insulin-producing cells after expansion. This will reduce the dependency on donors, allowing us to offer the therapy to a larger amount of patients with a less cost. In our third product, we will develop a technology to overcome the immunorejection and eliminate the need to immunosuppression medications. Betalin owns 2 families of patents that were granted, and now we are working on the third one to protect the outcome of our scale-up and optimization process. In 2010, Professor Eduardo Mitrani began the research activities with a $3 million budget of a non-dilutive funding and research grants. In 2015, Betalin was formally founded. We started our R&D activities at Professor Eduardo Mitrani lab at the Hebrew University in Jerusalem, and we won the support of the Israel Innovation Authority of 50% funding of all our research activity. In 2016, our patents were granted in Europe and are still in process in the US and worldwide. We established our own lab at Hadassah Medical Center in Jerusalem, and we successfully submitted an initial consultancy folder to the FDA. In 2017, we conducted in vivo experiments in diabetic animal model, and we built our own engineering machine for producing the micropancreas. In the next 24 months, we are planning to have a formal meeting with the FDA by the end of this year, early next year. And by mid next year, we are planning to freeze our product and submit a request to start a clinical investigation, hoping that by early 2019, we will start a clinical trial. For that, we are seeking to raise $3 million for a period of 24 months to allow us to initiate our clinical investigation. For your time and hope to get your support. Thank you very much.